This is Kristina Fiore of MedPage Today reporting from Digestive Disease Week in New Orleans. Pay for performance measures may not take into account some of the complications that physicians can't control. Obesity, for example, puts some patients at higher risk of problems during some surgeries, as Dr. Kenzo Hirose of Johns Hopkins University explains.
Obese patients do incur higher complications following these two operations, and that their cost to the healthcare payers is higher.
Hirose and colleagues looked at claims data on patients who'd had appendectomy or cholecystectomy.
The questions we asked were, how does the diagnosis of obesity, and essentially we identified obesity by diagnosis code as well as body mass index over 35 when that information was available. How does obesity impact the outcomes within 30 days after surgery, and also how does it affect the overall costs of healthcare of caring for these patients for their inpatient hospitalization and for 30 days afterwards? And in that perspective, we were particularly interested in how this might affect reimbursements now that there's been a great impetus for implementation of pay for performance.
Obese patients had significantly higher complication rates.
When we looked at the outcomes after appendectomy and cholecystectomy, there was a significantly higher complication rate as identified by the claims. And for appendectomy, the complication rate was roughly 21% for the obese cohort of patients and 16.5% for the non-obese. A similar trend was seen in the cholecystectomy patients, somewhat less robust a difference, but certainly statistically significant.
These patients also cost more to care for.
And so for appendectomy, the difference was $15,400 versus $14,180, and in the cholecystectomy patients it was $18,663 versus $16,692.
Researchers worry that pay for performance may especially discriminate against minorities.
If pay for performance were to be adopted in this patient population based purely on the outcomes, this cost reimbursement pattern would actually reverse, that you would actually be paid less for the patients who are at higher risk for complications. And we feel this is fairly inappropriate if this were to be adopted, given that certain healthcare providers, certain hospitals have a higher burden of obese patients, and in particular some of the safety net hospitals that care for patients in the inner city who are of Black and Hispanic ethnicity and lower socioeconomic status that are at higher risk of obesity could be unfairly penalized for caring for these types of patients because of their risk of higher complications.
The fear is that some centers will stop taking high-risk patients if pay for performance measures are implemented. At Digestive Disease Week in New Orleans, I'm Kristina Fiore, MedPage Today.